There are many mental illnesses out there in the world right now, and to be honest, some of them are very easy to pick up on. But the opposite is also true, that there are plenty of mental illnesses that don't seem like they're happening to someone or yourself, and yet they absolutely are. A great example of this is depression. A lot of people can wave off depression as just having a bad day or period, but it can affect their whole lives, and thus it's open to their close friends or even themselves to realize the truth before it's too late. So allow us to show you signs of depression that you should not ignore. Be sure to like the video and subscribe to the channel. Number 1. Erratic sleep patterns and staying in bed. There are a lot of misnomers about depression that can lead people to doing bad things that'll only make them feel worse in the end. Depression is known to go and sap energy, and thus you'd think that you'd sleep better as you feel tired at the end of the day. But as we all know, your body can be tired, but if your mind is firing on all cylinders, you're not going to sleep. Depression can leave you feeling drained, but then when you go to sleep, you realize that there's nothing to let you go to sleep because you dwell on all that's happened during the day or past week, and as a result, you're trapped in an awake state. On the flip side, if you do get to sleep, your depression can lead you to saying, "I'll just stay in bed," and completely throw yourself and your routine out of whack. Having a good routine is essential to fight depression. So if you or someone you know is bucking that to just stay in bed all day, that's a problem, and that's depression. Number 2, it's hard to work. As we just noted, depression is known to sap your strength and thus make you feel bad. But another aspect is that when it comes to work, depression just doesn't want to let you do it. It makes things very hard for you, even when it's just the most basic of tasks. Dr. Will Sov, Virginia Regional Medical Director for Greenbook's TMS, notes that cognitive impairment is a major symptom of depression and probably the most common. Word finding, processing speed, maintaining attention, switching attention. All of these cognitive skills are diminished in those with depression. Now, if you're just tired, that's one thing. But when you find that not even the simplest of jobs or assignments is within your grasp, then you definitely have depression and need to either get help or help out those that are showing this particular sign. Number 3, eating habits. A classic TV or movie trope when it comes to characters feeling bad or depressed is that they'll eat their feelings with something like a vat of ice cream or pigging out on snacks. Is this actually a sign of depression? Technically, yes, but it's not the only eating sign you should look for. You see, there are those who will go and pig out on food, regardless of the kind and type, to feel something and to have something in their stomachs they can enjoy. But they can also swing it in the opposite way and go a long time without eating anything meaningful. They feel too drained to go and do things like cooking or even getting up to grab a drink. So be mindful of how you and others go and eat because it could be a clue to how they're feeling. Number 4, loss of interest. Think right now about your favorite activities. If you could go and do anything right now after watching this video, what would it be? What fills you with joy just thinking about it? Well, a very common symptom of depression is not feeling good about an activity that you love. Whether it be reading, writing, singing, hanging out with friends, or whatever trips your trigger, if you go from loving it one day to not feeling up to it, that can be a sign of depression, especially if it happens multiple times in a row. Number 5, picking fights. When you're emotional, things can be said or done that hurts you and your family. But being depressed is just as bad, because your depression voice, as it's known, will go out of its way to make you think that others don't understand how you feel, and thus will want you to lash out at others or overreact to situations that don't require such raised emotions. So if you or someone you know are picking fights with friends or family in a way that they would never do before, there's a problem. Number 6, irritability and mood swings. Depression can cause us to experience outbursts and mood swings. One minute we're angry, the next we're crying uncontrollably, or we shut down and go numb. Changes in our mood can switch in a moment's notice. Sometimes these changes can be triggered by small or insignificant challenges, while other times they can come about unprovoked. If you notice a pattern of irritability or mood swings that last more than a few days, it may be linked to depression, and you should check on that person or yourself immediately. Number 7, pained body. A lot of people prescribe to the belief that the mind has an incredible power over the body, and that belief is absolutely true. In fact, the mind is able to do things for your body that you don't even realize, as long as you're willing to go and think about it for a good amount of time. Depression is absolutely powerful enough to make your body do various things, not just sap your energy, but make your body have lots of little aches and pains that just make you feel worse than you already do. If you're aching and you don't know why, it might be because of depression. Number 8, being hyper and overly happy. Yeah, didn't see this one coming, did you? But it's true. While depression is known for sapping energy, it can also lead to an uptick in energy if something bad is going on in the mind. For example, some people might be overly happy because they're trying to compensate for their pain and trying to come off as normal, when it's more like coming off as manic. What's more, having lots of energy might mean that they're thinking of doing drastic things in order to feel something, and that'll lead to lots of problems down the road. And it also has been proven that this jump in energy can lead to suicide, because the person has come to a conclusion about their life and they want to get everything done before completing the task. Number 9, antidepressants aren't working. If you're taking antidepressants, it's good to keep an eye on your mood and energy levels to know how your symptoms are improving, and discuss your progress with your doctor. That way, you can gauge how effective treatment is for you and whether you need to make any changes. If you notice that your antidepressants aren't working as well as they used to, could be a sign of treatment-resistant depression, or depression that doesn't get better after trying medications. You have to be conscious about this, else you're taking medicine that won't ever help you. Number 10, can't connect. With depression in your mind, or in someone else's mind, it's very common to go and find yourself not connecting with anything. You see something that usually makes you happy, and it doesn't do anything for you. You go and do a work task, and it just feels mundane, even if it's a good job you honestly love. You go and talk with family and friends, and nothing seems to be right. That feeling of not connecting is a key symptom of depression and should be watched out for. Number 11, guilt. To be clear, just feeling guilt in regards to something you've done is not a sign of depression. However, when you start feeling guilty about everything and anything you've done in the past or present, or even what you might do in the future, that is a sign of depression. Your depression voice will make you think that everything you do is worthless, pointless, and not going to make you feel better. And the guilt will pile on and make you feel even worse. So if felt, get help. Or if seen, get them help. Number 12, constantly on edge. In many people, depression can manifest with irritability, impatience, or anxiety and worry. Women are especially prone to anxiety symptoms along with depression, says Diane Solomon, PhD, CNM, and psychiatric nurse practitioner. In short, you're always on edge. You react to everything going on, even if it's the slightest of triggers. That kind of edginess is not healthy, nor something to be ignored. So what do you think? What do you think of this look at the various signs of depression that shouldn't be ignored even if you only barely notice them? Do you think you'll be able to remember these signs and warnings and be able to help those who have depression? Are you going to be keeping an eye out for yourself now that you know what might set you onto the path of depression? Do you know the other signs that people and you should be worried about? Let us know in the comments below. Be sure to subscribe, and we'll see you next time on the channel. Take care.